Welcome to the recorded webinar, Improving the Quality Measures, Percent of Long-Stay Residents Who Were Physically Restrained. This webinar is part of a series intended to help nursing homes understand and improve the 13 long-stay measures that are used to calculate the Quality Measure Composite Score. This measure reports the percent of long-stay nursing facility residents who are physically restrained on a daily basis. The numerator for this measure is the number of long-stay residents with the selected target assessment that indicates daily physical restraints, where trunk restraints used in bed, which is P0100B, is coded as 2, or limb restraints used in bed, P100C, is coded as 2, or trunk restraint used in chair or out of bed, P0100E, is coded as 2, or limb restraint used in the chair or out of bed, P0100F, is coded with 2, or finally, chair prevents rising used in chair or out of bed, P0100G, is coded as 2. The denominator is the number of long-stay residents with the target assessment except those with exclusions. And there are 5 exclusions for this quality measure. P0100B, C, E, F, or G is coded with a dash, which means they were not assessed. Those are the only exclusions. To help identify what your team can do to improve this quality measure, refer to the RAI Manual Appendix C to find the Care Area Assessment for Physical Restraints. The Care Area Assessment process provides a framework for guiding the review of triggered areas and clarification of a resident's functional status and related causes of impairments. It also provides a basis for additional assessment of potential issues, including risk factors. The assessment of the causes and contributing factors gives the interdisciplinary team additional information to help them develop a comprehensive plan of care. For each resident who triggers for this quality measure, evaluate the current restraint use, the medical conditions or treatments that may lead to restraint use, and the cognitive impairment or behavioral symptoms that may lead to restraint use. For each resident who triggers, also evaluate the risk for falls that may lead to restraint use, any adverse reaction to restraint use, and any input from the resident and/or family or representative. Then, analyze your findings, and for each resident, document a description of the problem, the causes and contributing factors for the restraint use, as well as all risk factors related to physical restraint use. This information should then be used in the development and implementation of an individualized plan of care for each resident, which should decrease the use of physical restraints and thus help improve this quality measure. Implementing quality improvement in your nursing home works best if your home has a culture of quality that supports continuous quality improvement. Please refer to the CMS National Nursing Home Quality Care Collaborative Change Package that offers strategies your team can implement to develop and enhance your quality culture. One of these strategies of high-performing nursing homes found in the Change Package is to provide exceptional, compassionate clinical care that treats the whole person by striving to prevent problems. Decreasing the number of physical restraints is a great example of this strategy. Please refer to the link on this slide to find other proven strategies to improve the quality culture within your nursing home. And refer to the MDS 3.0 RAI Manual and the MDS 3.0 Quality Measure Users Manual for more information about the quality measures. To clarify questions about the MDS and/or the quality measures, contact your state RAI coordinator. For more information about restraint and alarm reduction, go to the Lake Superior QIN's YouTube channel and watch the webinar, The Alarm and Restraint-Free Environment. For further information about the quality measures or about the National Nursing Home Quality Care Collaborative, please contact your state Lake Superior Quality Innovation Network lead listed on this slide. And be sure to check out our other short webinars and each of the 13 quality measures that make up the composite score. Viewing the videos for each of the measures will help your team understand how each measure is calculated and will offer suggestions on first steps to improve each quality measure. Thank you.